Today we will be presenting a proposal to expand the clinical pharmacist role here at the WeCare Internal Medicine Clinic. It is found that women are more susceptible to various chronic diseases. For example, cardiovascular diseases such as heart disease and stroke are the leading cause of death in American women. Currently, clinical pharmacists play a limited role in the management of chronic illnesses here at WeCare Internal Medicine. By expanding the WeCare Internal Medicine Clinic, pharmacists can aid in reducing polypharmacy and adherence problems, as well as assist in the management of chronic diseases. Our expected patient population will include women ages 35 to 85, with the average age being 62. As of now, WeCare clinical pharmacists only play a role in the management of dyslipidemia, diabetes, and anticoagulation. Our expansion will include other common diseases such as heart disease, which will include hypertension, atrial fibrillation, and heart failure, thyroid disease, osteoporosis, and COPD. Our patients will be referred to our clinic by their physicians, but walk-ins are acceptable and encouraged. Our staff will include 12 full-time physicians, 3 clinical pharmacists, and 1 receptionist to greet patients and schedule appointments. Our clinic hours will be Monday through Friday, 8 to 5 p.m., Saturday, 10 a.m. to 5 p.m., and our clinic will be closed on Sundays. In case of emergencies, patients have access to a toll-free number but are encouraged to call 911 if the emergency is serious. Here at WeCare Internal Med, we operate on a collaborative practice with our physicians. Our pharmacist-specific roles will include, but are not limited to, medication reconciliation, where they will run further drug interaction reports, determine any unnecessary drug therapy and doses, and provide patient education on their medications. Additionally, pharmacists will interpret the patient's symptoms, labs, and overall knowledge of disease states in order to provide the appropriate recommendations to the physicians. At every visit, our pharmacists are responsible for encouraging healthy lifestyle practices and scheduling follow-ups with our patients.
Our treatment algorithm will depend on each disease state, but the overall flow is seen here. First, we want to establish the disease that we were talking about, provide the medical reconciliation and education, assess the symptoms of the disease, and determine if the patient is at goal. If they are at goal, we can continue the medication and encourage exercise and healthy lifestyle, and set up any necessary follow-up. If the patient is not at goal, we want to review the patient's meds, labs, and recommend a new treatment to the physician. Upon that, we want to educate the patient on further changes to their medications and set up an appointment as necessary. Patient monitoring will depend on the disease state, but overall we want to get a lab of the renal function, address any adverse drug effects, address patient adherence, and any difficulty accessing medications. For heart disease, we want to get a blood pressure, heart rate, pulse, and INR if necessary. For thyroid, we would want to monitor the patient's T4 and TSH, along with the patient's energy. For osteoporosis, we want to monitor bone marrow density, bone turnover markers, and vitamin D. For COPD, we want to monitor exacerbations and FEV1. Pictured here is a sample of our patient documentation that our pharmacist will fill out after each visit. They would include the patient's name, their chief complaint, some subjective information, objective information, and the plan and assessment that the pharmacist wants to enact, along with the pharmacist's signature and follow-up date. Patient billing and services. Since we operate in a collaborative practice with physicians, patient services will be billed through physician codes. Any co-payment will depend on the patient's insurance, plan, coverage, and will be paid on each date of visit. In cases where patients are uninsured, they will pay for specific services as appropriate. Monthly plans will be initiated if needed. This concludes our WeCare Internal Medicine Clinic proposal, and these are our references that we used.